So today what we're going to talk about, it's not the most uplifting topic initially, but we're hopefully going to have a little fun with this and talk about it and just get you ideas and ways to think about sort of how to talk to kids and what's their understanding of death. When they had asked me actually to do this talk, they kind of were like, well, you can choose what you want. And this is actually one of the things that I talk about a lot. I think part of the reason with that is that when I was in residency, I started working a lot with like oncology groups and stuff down at Santa Rosa with a lot of kids with death and dying and things like that. So it sort of became one of the things that's really important to me. The Children's Bereavement Center here in town, if any of y'all are familiar with the Bereavement Center. So when it first opened, we were back at the gymnasium of a Methodist church over off of Vance Jackson. And so I volunteered there for a couple years and loved it. And so it's always kind of been one of those special places with me, and I try to get a lot of my students and residents to go over there and volunteer. And so I learned a lot from them. And so this is just one of those subjects that a lot of people are scared to talk about. So the way that I do like to lecture too is I have all these slides. We're going to go through a bunch of different things. We'll talk about it. But if y'all have questions while we're going, just raise your hand, okay? Because if it's one of those you think it's not really relevant at this point, then hold it till the end. But if it's something that's, I've got a question about this, what you're talking about right now, just go ahead and ask it, and we'll just kind of stop and go through it then and go from there. And then at the end, we're going to talk a little bit about the beating the holiday blues part. That's a whole kind of we're doing a two-part little talk. All right, is that good? Okay, and if y'all think of anything that in particular, if I'm going through something and you're not sure if it's going to be covered and you really want to know, once again, raise your hand and just ask. And if it's going to come later in the presentation, I'll say, well, hold that thought. But if not, we can talk about it right then. So, all right. First, here's a little bit of the Child Guidance Center. I think most people are probably familiar with us here. The neat thing is that when we did the merger with the Child Guidance Center and then the Clarity in the Southwest Mental Health Center to create Clarity Child Guidance Center, it was neat. You took two nonprofits, both United Way organizations, who really just love helping kids. And so now we're one big organization that's United Way nonprofit that loves helping kids. So it's really kind of neat. So, okay, so I have a lot of clip art in here, and I think part of that too is that one of the things I always tell my residents in clinic is that what's really important is that for us as adults, if somebody comes to us and say, well, what are you feeling? What's going on? We have a lot of vocabulary. We've got a lot of words that we can explain that, right? You know, we hope that we're able to say, here's how I'm feeling, okay? If you ask a 3-year-old, how are you feeling? They just kind of look at you, and they don't understand. And so for them, you're asking, it's almost like a different language sometimes. And so with little kids, 3, 4, 5, I started doing it with the young kids, and then actually now do this even with my teenagers. They come in, I'm like, okay, 3 things. Are you sad? Are you mad? Are you glad? And they kind of like look at me, like, those are our 3 base emotions, okay? Sad, mad, glad, okay? You figure out what that is that you have, and then as we grow into adults, as the kids kind of start moving up, well then sad can go from, I'm a little unhappy because I got a bad grade, or I'm very depressed because, you know, my pet died or something. So then it starts to say, wow, I've got a whole range of emotions. But at the beginning, all they have is that one little one, and then that's going to spread out. So you have to really help them understand what they're doing. But if you ask a kid, are you sad, mad, or glad sometimes, and let's say they say sad, and then you say, well, what are you sad about? Okay, those of you who work with a lot of the younger kids, they just look at you, and they're kind of like, they can't verbalize it. They may not have that sort of the vocabulary to be able to explain what's happening. So the best way you can get a kid to talk is get their hands busy, okay? And so I always have, you know, either, well, we can't use Play-Doh as much anymore because apparently Play-Doh carries germs. That's what they say. So I can't do Play-Doh as much anymore. But crayons and things like that, you got to find things that kids can do. So if you get those little bitty things of Play-Doh, give it to the kid, they can take it home, or sometimes we'll use molding clay. But you get a kid busy, and if it's a kid who's angry, what are they going to do when you give them some Play-Doh and molding clay? They're just going to pound it, and they're going to squeeze it, and they're going to just do something with it. So for you, you're looking and saying, wow, that process is very important. It may not be the end point because it's still going to be a lump of clay or a lump of Play-Doh. But then you have other times where you have a kid, you're also watching that process to how they get there. If you get a kid and you give them crayons and a piece of paper, I mean, if I could only have one toy in my office, it's crayons and white paper. That's it, okay? Because you get down and you say, start drawing. And it doesn't matter their age, even adults, you'd be surprised. They do great with that. Because you give them that and they start drawing what's in here and what's in here comes out on the paper, okay? So it's really important, and it's not just what they're drawing at that one point, but every visit, if you have them draw, you can watch the progression of a child based on their drawings and how they do. So that's why you'll see a lot of this clip art, because when it comes to death and dying, a kid doesn't understand based on their developmental level about death, what do? You give them a piece of paper and they'll tell you. Okay, and so a lot of these ones are clip art, but they're based on some pictures that kids have done. And you'll get kids who'll say, I feel like my heart is breaking, and you see how it's all jagged and stuff, and they're like, it just hurts. My heart just hurts. Okay, then you have other times where it's like it's a little happier and stuff like that. So we'll have a couple different ones. So a couple thoughts at the beginning as you look here. Is that one is that with kids, it's so hard to talk about because they're not supposed to die. Okay? If you think about, if any of y'all have ever worked like at the VA or nursing homes and stuff like that, and if you have a patient who is, 85 years old and very physically sick, you know that they may be dying. Okay? But then the younger somebody gets as it progresses down, you're like, well, they haven't had their whole life. They haven't had the full life that we say with older people. And so you'll say, kids aren't supposed to die. They haven't gotten to live. And so you really have to kind of be able to address that and say, you're right, they're not supposed to, but is that going to keep you from helping the kid go through this process? Okay? And if it is, if you're kind of like, I can't deal with this right now, then don't. Because sometimes what happens is you have, well, actually, I'll give you an example. Yesterday, I had a student in my office one of my medical students, who they are working on a certain part of the body in anatomy, which basically they're doing the thorax and they're doing lungs and stuff like that. And the girl's aunt who raised her, who's like many states away, actually basically was diagnosed with terminal lung cancer and was put on hospice. And so the person is dying, and the body that they're working on in their anatomy lab was somebody who, when they looked in there, that the lung was all messed up and it looked like they had had lung cancer, and she just fell apart. Okay, and so do you see how that would be a time, if you're, whatever we're all doing in life, she kind of comes into my office and is like, I can't do that. And I was like, fine, you can skip this lab. Don't worry about it, and we'll talk with the professor later on and stuff, because it was too emotional right then. So if any of you guys come across something where you have, a family member die or somebody who's close to you die, and then somebody comes in to see you for therapy, and they're going to talk about death and dying issues, you're not going to be helping them if you can't manage it yourself, if you feel like you're barely holding it together. So that's why you always have to make sure you're in the right state of mind, and then you always have to have other resources where you can contact somebody else, because it's really hard, because kids aren't supposed to die, but they do. The other stuff is our culture here really notes death as part of life. You get some cultures where they glorify it, and they say you're moving on to a different place and stuff like that. And so here in our culture, it's not so much. People really focus a lot on the death part, but not as much as what's happening afterwards. And that's very individual on everybody, for every different person. And the other thing is kids experience the world differently. This goes back to sad, mad, glad. Okay, you got to make it simple. You got to figure out what they can do. There's lots of different ways that you can do that. You have to figure out what is the kid like and how is that going to help. Okay, and so we'll get through some of that a little bit more. But why it's so hard for parents, and this is more, when we're talking about this, I'm not really talking as much about if a child dies or if a parent dies. This is a little bit of both. We're going to talk about kids' understanding of death. But some things that are important to know is how people do. Parents basically say, my kids are going to outlive me. If something happens and you live longer than your child, it really shatters your whole world and expectations that you've had for a very long time, because that's just something you may subconsciously have in there. So that's something that you want to worry about, because if something happens, it completely disorients you and disrupts you. And I've had kids who are terminal illness who the parents are like, don't tell them that they're going to die. And the kids are like, could you please tell my parents that I know I'm going to die? And the kid says, I'm having to be strong for them, when the kid's kind of like, I'm ready to go, but mom and dad aren't ready for me to go. Okay, it's amazing what the kids will tell you when they're going through some of this process, when you just sort of stop and listen and stuff like that. Denial helps parents cope, but if you deny it for too long, it's really bad. Y'all hear lots of stories. When I do all my talks, I always give lots of stories and examples. Last week, my wife's a pediatrician. She's working at Santa Rosa, and last week she had this kid that was very sick. And the kid was, at some point, the kid was they're doing a lot of the end-of-life issues and stuff like that. And the problem is that the parents would be like, he's not eating. He's got the G-tube and all this stuff in. They're feeding him through the tube. And the mom's like, well, don't worry. I know, in a couple more weeks, he's going to get better and he's going to start eating hamburgers again. And the kid is so sick that he's actually in the hospital a lot. My wife is a hospitalist there, tries to explain to the parents, and he's really sick. He may never eat again. We need to look at other ways that we can work on getting the nutrition and the food in him. And the mother's like, I don't want any of that because he's going to get better. Okay, so this has been going on with this family for months. Okay, so what happens is my wife comes home and she's kind of very frustrated. Maybe at times she likes that she's married to a psychiatrist, and other times she doesn't. But this was one of the ones that she actually liked, because she came home and she's like, I'm frustrated. She's like, I don't want to call and say, this family's giving neglect to their child, because they're not. They love this kid to death. But she says, but they're not listening to the medical advice when we say, this is what this kid needs to get better. And the family says, no, because he's going to get better on his own. Okay, so that's where the prolonged denial can be bad. Okay, a parent may say, I may not like this, but let's do what's best for the kid. Okay, so let's go on past that. So this is, I think, one of the most important things, okay, is because the key to how a kid does is how the parent does. There was this family that I see, and I see, let's see, 2 of the 3 kids in the family, and I've now seen them for, I think, 9 years. Is it 9 years? I think 9 years. And after I'd been seeing them for about a year and a half, the oldest boy at that time was 7, and the father was shot in the head and killed in this kind of drug-related type thing and stuff. And so, as you can imagine, there was a lot of that confusion as to what do we tell the kids and what don't we tell the kids and stuff. And so the boy wanted to be there when they turned off life support and stuff like that. And the parents called me, what do we do? I was like, well, ask him. And he's like, I want to be there. I said, well, then let him be there. Because then he's not going to hold it against you down the road that you didn't let me be there. So then at 7, but what happens is the rest of the family, in a very supportive way, go up and say, you are the man of the house now. You got to take care of your mom and your brother and sister. He's like, okay. So his next appointment, he came in. Do you know what he asked me? He asked me if I could teach him how to balance a checkbook because mommy's so sad she can't do it right now, and he's the man of the house. He's like, does this mean I also need to go get a job? At 7. And because his understanding, the family, and it was really neat because the family, when this happened, the grandparents were coming into the appointments too, and the grandparents just start crying, and they're just like, we didn't mean that. We just meant you're the man of the house. And I said, well, exactly. I said, so what do you mean by man of the house? So then when they explained it, we just did some communication, and it all got better. But the boy, if you're the man of the house, what do? I've got to take care of things. So he's thinking, should I quit school? Should I get a job? It's 7, okay? So we got to think about how we say things. But part of the problem with that is that instead of the mother being able to kind of address that a little bit more, when the father died, she went into such a severe depression that she was no longer acting as the parent. So he actually did have to step up and act a little bit like a parent. Make sure that, okay, the kids are dressed, okay, his brother and sister, everybody's okay for school, okay, and he would do things like that. And so the mother was kind of a little, at first, got so depressed she didn't see it herself, so it's kind of, that's when the grandparents started coming to the appointments, and we said, Grandma, Grandpa, you're helping out with the kids right now until we can get mom back on track. So that is what is important. We may focus on a kid, like if a parent dies, but we got to remember, we got to focus on that other parent almost as much because kids don't do well if the parent doesn't do well. Okay, so now this picture, this was a kid. A lot of these pictures I have are places from like the Dougie Center and various places across, the nation and stuff that have kids draw things. A theme that you'll see a lot is masks, because kids say when they get sad or whatever, a mask kind of hides you, and so you can be someone else. You can be sad, you can be whatever. But the mask, think about it, a mask doesn't change. So you can put on a mask, and you can feel however you want inside, but people are only going to see what's on the outside. What's interesting about this kid drew this mask, and I don't know if y'all can see it very well. It's really kind of hard. It doesn't always show up, but do you see kind of like right there? Actually, let me come over here. After this was drawn, somebody actually asked the kid, they said, is this a head, and is this a body with a leg and an arm, like somebody, like a person in the background? And the kid was kind of like, maybe it is, because his dad had died. And he's like, maybe that is my dad, I don't know. And so the kid draws this. And so whether it is or not, I don't know if you come up and look closely, but it really kind of looks like a person. So afterwards, the kid started to think, I think maybe I was. I was thinking about my dad while I was drawing it. So this shows you that sometimes our mind is an amazing thing. I mean, maybe that's just chance, but the kid was like, I think that could be my dad, because it's also kind of in white, because stuff, everything else is black, because he was like, Dad went to heaven and this happened and stuff. So it's really interesting to just look at a picture that a kid did and then say, what do you think this is? And get their opinion. We can always interpret how we want, but it's kind of what they think is really important. So this comes back to development. This is the teacher in me, is that everything is about development. You have to understand kids' development. If you understand that, that's like half the battle. You learn how to talk to kids at certain levels and stuff. So what influences, their attitude towards death and stuff like that? Developmental stage, okay, and we're going to go that. We broke it up. I have it broken up into a couple different stages. Age of the child, parent-child relationship. If the parent, like let's say it was a parent who died and the mom and the son didn't get along before, and then the dad dies, who is maybe the bridge between the two, okay, they're not going to all of a sudden start getting along better. Okay, so you got to remember how was the relationship before, and then also how the parent died. I've actually, unfortunately, had about 5 or 6 of my medical students. We have about 900. I've had 5 or 6 who've had very close family members get sick or die within the past about 2.5 months. And 2 of them happened close together. One of them was a car accident, sudden illness. They died. It was tragic. And the other one was a long-term illness. Okay, there was the one who'd actually been with the hospice. Her grandmother's in hospice and stuff like that. And so what you look at, and they're like, maybe it would have been better if this would have happened right away. And then the other person who had happened right away said, I wish I would have had time to prepare for this. Okay, it's never easy either way. It just depends on, do you do your grieving ahead of time? And then when the person dies, if it's a chronic illness, then actually you do a little easier afterwards? Or does it happen suddenly, and then your grieving is after the fact? Okay, it's just 2 sides of a coin, okay, but it's kind of dealing with it. So another one, parent with a kid, just a little picture. Okay, so 3 different little definitions real quick. First one, you have grief. Grief is the process, okay, the emotional reaction to the perception of loss. So grief is what we all have, okay, this is what our emotions do and stuff like that. Mourning is the actual response. That's a cultural reaction, okay? That would sort of be, are you expected to wear black? Okay, what type of a funeral service you can have. That's all part of the mourning process, okay? And then the last one is bereavement, which is the condition of having suffered a loss, okay? So you have bereavement, everybody who has a loss. And do you notice how, if you look at these, I didn't put death in there? Okay, this is not about death, this is about a loss. You could go through these, okay, for a divorce, kids whose parents get divorced, any kind of a loss, it could be any kind of a loss. So when you look like this one, bereavement, condition of having suffered a loss, okay, so that's like, we all go through bereavement. Now what happens is we have to look and say, if it's in regards to a death, is it a complicated bereavement? Means, is there something abnormal, okay? Are you severely depressed? Is it impairing your functioning? Are you hallucinating? You know, seeing like visions of the person, stuff. Lots of different things. So there's just a couple definitions right there. Are y'all familiar with these? The little stages, okay. There's actually one of the funniest clips. If anybody ever watches The Simpsons, there's a thing where Homer eats a blowfish. And they say, we're sorry you're going to die. And it's a 30-second little video clip where Homer Simpson goes through all 5 stages. And at the end, it's like, well, okay. And it's the funniest thing ever. And I would show that a lot of times with you know, various talks that I would do, because it shows you is that when we don't understand something, you know, always, or even if we do understand it, we like to use humor as a healthy defense mechanism that we do. So you will see things where people will joke about it. So The Simpsons one, it's hilarious because at the beginning the doctor says, Homer, you know, you're gonna die. And he's like, and you're gonna go through 5 stages. And he goes, and that's not true because I'm not gonna die. And then the second one, he says, and then the second one is anger. And he goes, why you? And he starts shaking the doc. And then the second one is, he goes, and then bargaining. And he goes, hey, come on, doc, make me better. I'll make it worth your while. And he like starts pulling out his wallet. And then the disbelief is he just sort of is like, this isn't really happening. I think you're making this up. And the last one is acceptance, where he goes, well, we all got to go sometime. And it's a 30-second little clip. And he goes through all those 5 stages perfectly. And it was just so funny to see. So you sort of see these things in media and various other things. And you can see the way that it actually is. But the difference is what they don't show in that is when you look at your stages, you don't have to like complete denial before you go into anger. Okay, you can be going through multiple ones at the same time. You can get stuck in one stage. You can go through 4 of them and then still be stuck in one other one. The bereavement center, there's this one family that we had that the mother and daughter got a little enmeshed, I think, after the father had died. But they were both so stuck in the anger phase, and they were angry at, you know, he had a car accident, and they were so angry at what happened and the company or the doctors that didn't save him, and you know the people around who didn't do CPR fast enough or whatever, and they held on to this anger. Okay. Apparently, they said that before me they'd gone through some of these other stages, but they held on to that anger, and it was a really amazing process to watch them finally, after like a year and a half, start to let go of some of that anger. Okay, it's a really amazing thing, and then eventually people will get into that acceptance. You know, you can get into acceptance, and you can still have some anger. It's fine, but these are stages that everybody goes through. Okay, they can be brief, they can be long.